So the good news is ultimately, I don't know whether you guys see any of this kind of stuff, but ultimately in Warwickshire, for our geographical makeup, because in fact we've got lots of warehouses, lots of big manufacturing centres, although we are rural, we do have a lot of those. Warwickshire is seeing actually a lower proportion of cases than we would expect. And we as a public health team are putting this down to the fact that we, as our settings, our workplaces, our schools, our teams, have all been really well versed in the right things to do at the right time. So first of all, say thank you to all of you that have worked really hard, even when you're absolutely exhausted, to keep infections down and do the right thing and self-isolate. And you guys have been through a really hard time for the last almost a year now. So just to say, you've worked really, really hard and your hard work is paying off. And as you can see here, this is the second wave, and then they're referring to since Christmas, the third wave. You can see that in Warwickshire, that is coming down. So it's coming down quite a bit there. We've plateaued slightly, but you can see that we're not going on that increase that we were seeing before. Now, this is all the districts across Warwickshire. So that's all five over the 7-day rolling average. And what that is we take the figures by day and take the last 7 days and just average them out. It just creates a smoother curve so we can see exactly what's happening. And over the last 5 days, over the last 7 days, all 5 of our districts are coming down. We were seeing in areas like Rugby and the Neaton, we were kind of approaching that 600 mark, but you can see they're all coming down quite nicely now. As we do know, currently in the last 14 days, the wards which have the highest rates are Newbold and Brownsover, Slough, Poplar, Admirals and Corston, and Exhall, and that's where most of our cases are at this time in the last 14 days. So as you can see on that map on the right-hand side, you can see there are areas of more density. Whereby we've got more cases, but all 5 districts are coming down. The highest district at this time is Rugby. Now, they were approaching 600 only a couple of weeks ago, followed by the Neaton and Bedworth, North Warwickshire, Warwick and Stratford-upon-Avon. And actually most of these cases are in working age adults and also in sort of the over 60s in care homes where we've had very large care home outbreaks. We're not seeing massive numbers of figures in our under 20s or in our children. We're not seeing massive figures there, but obviously the staff that work in your settings will form part of those working age figures. So that's just some of the figures. So I'll just see, just go back to the presentation, see if there's any questions or queries yet. Okay. Just comments in general. So ultimately, we are now seeing a larger number of outbreaks in nursery settings, and there's a few reasons why we think that this could be. So if I just take you through some of the things, which I'm sure that everyone is doing this to the hilt, and I know it's exhausting to keep reminding staff about some of these things, but these are some hints and tips that you can do around your setting to again keep things to a minimum. Now, we've just had this week released a paper on ventilation. So actually the scientific proof now, whereby they've used carbon monoxide detectors and carbon dioxide detectors in rooms, that those that have the highest proportion of carbon dioxide in the air have the highest rates of transmission in the room, and therefore the rooms which are the draftier and have the windows open have lower rates of transmission. Now, we've seen higher amounts of transmission on the run up to Christmas, and we think that this is a lot of settings not having their windows open as wide as what they were. Now, I appreciate that you've got lots of really small children, and these rooms are already quite cold, but it's reminding parents where you can. And again, a lot of this is just what we're finding. So if this is something that's totally impossible for your setting, by all means, sort of just take the notes as they are and push back or be like, no, I'm sorry, but that can't work for us. But ultimately, we need to keep the ventilation as much as possible in the rooms to keep the air circulating so it doesn't build up if there are any cases in the setting. And that can prevent outbreaks once you have cases, in your setting. setting. And you can warn parents by sending them a note to say, you know, we are keeping our windows open. We do appreciate the temperature has dropped, so do bring maybe more layers into the setting. So we appreciate that. That may not be easily done. So yeah, we've asked parents to layer up their children. Yeah. Parents were fully on board. Brilliant. So those that can do that, you know, obviously everyone has different clientele and you are businesses at the end of the day. So, but yes, keep your windows circulating the air. Another thing that we found around some of the weaknesses is the handovers. So we've had a few parents that have tested positive and they've come into close contact at the handover as they've dropped the kids off and as they pick kids up. And vice versa, we've had staff who are doing the handovers, so they're actually touching or mixing with the children as they're leaving the setting and as they're coming in, and that has been an issue in some of our sites whereby that one person, obviously because they're in contact with everyone, they're more likely to get it, but because they're in contact with everyone, they're also more likely to pass it on. So where you have, I mean, obviously everyone has those handovers, but where you can do it ideally whereby they meet you at the door and they don't come into the setting, you know, the child comes in, the parents are left outside, and you accept them in and you choose a person that can either sort of distance as much as they can as they accept them in, or whereby you have a person from their bubble accept them in where possible. And it's just really about limiting the mixing of staff who accept children in and let children go, and also whereby where parents drop the children off, the child can often move forward. Obviously not always, some of them are very little and you have to do an actual handover, but where you can, keep parents at a distance to your staff as they're dropping kids off and as they're picking them up, ideally meeting at the door where the parent remains outside. Not always possible again, but again, these are just areas that have been picked up as weaknesses. Another one has been around covering rooms. So we had a situation whereby someone went into a room to cover it just for a matter of a couple of hours and obviously then later tested positive. Now, that person went into that room. They said that they were close contacts with children, but they couldn't remember exactly which children it was. It wasn't everyone, but obviously we have to close that entire bubble because we don't know which children they were. So if you have any situations whereby staff go in to do cover, it's probably really arduous, but it's worth keeping notes of the name of the child that you have done one-on-one with when you've covered a room, because when those staff test positive, then it just means that you have to isolate potentially everybody. Now, thankfully, in many of the situations, there is CCTV, and some amazing sites have literally sat and gone through an entire day's worth of CCTV of when children were in contact with which staff, and that has enabled us to keep some staff on site where they would have otherwise had to go off to self-isolate. But ultimately, because these settings, your settings are so overlapping in some instances, as much as we can keep the bubble separate and those covers keep documents of who they've linked over with or who they've mixed with is just really, really important. Again, just suggestions around some of the weaknesses that we've picked up in some of our outbreaks. The other thing is obviously staff links in general. So staff obviously are getting a bit fed up of this now, you know, we all are. There are times like sort of when they go out for a cigarette, when they meet for, when they have their lunch themselves, making drinks, sort of mixing of cups and things, whereby they can pick up the virus by having these interactions. And again, keeping those to a minimum where possible. It's you know, obviously we all have to eat lunch and your settings are very small. You don't really have those rooms separate for people to go and do these things, but it's just reminding staff not to be, if you're not within the same bubble, do not be within 2 meters of each other, which can be sort of the best way. Obviously at the minute, space is the best way to prevent transmission, and don't sort of share any cups or plates or anything across anyone, and just bear in mind of, you know, any close contacts. And it's always, as I've mentioned in one of the other examples about dropping children off and picking children up, there's always a member of staff or a couple of members of staff who seem to float across all of the rooms and the settings, or have some kind of contact with the rooms and the settings. Now, those are always the ones that will get it because they've got more exposure, and then they're more likely to be the ones that pass it on. And what I found in a few settings is that it's been that kind of butterfly staff member that has then closed multiple bubbles as a result of people not knowing 100% where they've been. And at the end of the day, it's no, you know, end of the day, those staff members just want to cover and support people, but there is weaknesses now in some of the settings around how people meet and how they mix. Some of this could be measuring floors. And I know, like, so it's really difficult, but putting markings on floors of where the handovers are, the distancing, where you've got any areas that staff might group. When you do pick children up or drop them off, it's marking the floors. And I know you do it for the parents, but often I find that the settings don't do it for the staff. And at the minute, because we're all exhausted, we're all COVID exhausted, we're all tired of COVID, well, you know, we get a bit lapse. And it always is that you get a lapse in staff coming together, and it's always that one moment that's happened, like a birthday cake's come out and people have been stood around it, that you'll get your case of COVID, and it's always at those times that something will happen and then there's spread. So just bear in mind that. So that's some of the main areas. The last one really is cleaning. So I do know that pretty much every setting I've spoke to us are using the Milton-based cleaner, like sort of the hypochlorite chlorine-based cleaners. And the main thing is around cleaning touch points as much as you can, where you've got multiple little hands touching things. Now, you're a setting where you've got millions of little hands all the time, so it's not easy, but the most spread appears to be around the staff. So where there's mainly staff touch points as well, of staff moving across staff spaces, those are the areas to focus on. Obviously, you're going to be cleaning the bits that have got the kids in. I mean, that's normal, but the staff crossover areas are really, really important. And I do know that all the settings have generally got the things where soft toys that you can't clean easily have now all been put away, and it's only the toys that can be easily cleaned that are being used. And again, make sure that you have like some really good cleaners, pretty good cleans in between children using them. Obviously, when you've got a bubble together, that's not so important. But obviously, trying to keep any sharing of toys as much as you can to a minimum where they've been chewed and whatever. You know, obviously, it's impossible to 100% control it in these settings, but it's just doing your best. So it's around sort of the sharing of toys and equipment. Don't share anything between rooms, but thankfully most people aren't doing that at all. You never share equipment between any of your bubbles. It's only those in the room. Just make sure that that doesn't happen. So ultimately, that's the main things about cleaning. Oh, the last one was around fogging. So a lot of sites have been paying for very expensive fogging. Fogging does have an effect of that. It kind of coats the surface and it coats all surfaces in a room. So if you're fearful that any of the touch points have got COVID, the fogging does work to clear the surfaces. However, they're not any better at this time than just a deep clean. So if you as a setting don't want to pay for very expensive fogging, you don't have to, as long as you're really assured that you've done a really good deep clean. And also remember that the fogging will only coat the surface. So if that surface is dirty, it's not going to get to the roots of that. And COVID lasts longer on surfaces when it's sort of in like a fluid. When it's left out to dry, like it's just a contact point, it's gone off the surface in about 72 hours. But when it's actually mixed with quite a lot of saliva, like you sometimes get on, like if they've been chewing a toy, then that can remain a lot longer on the surfaces if it was that level of wetness. So it's just bearing in mind that fogging can be used. It is expensive. It isn't any better than a deep clean. And if the surface is dirty, then the fogging isn't going to have the impact. So just to bearing that in mind. So I've mentioned some of the sort of weaknesses that we've seen around handovers, about staff covering, some of the staff links, about measuring the floors. Also, where you have children that might sort of spit or be particularly sort of salivate quite a bit and rub that onto staff. If there's any staff that are concerned, then there is actually some like disposable long sleeve capes that people can get, a bit like the disposable aprons but long sleeves, and also where there's spitting, staff can can wear visors, and that can help prevent further transmission. Again, that's only when you've got COVID in your setting, but if there are fears, that is a way that you can protect yourself against children who are particularly sort of saliva touching and also who spit. You can have a long sleeve capes and also sort of visors, and that can create some form of protection against the transmission of COVID in those situations. Ultimately, we are now recommending, although in the guidance it still states that to be a close contact of COVID, you have to be within a metre face-to-face for any length of time. So straight away, you're a close contact if you're a face-to-face within a metre for any length of time. But then there's some further rules, and that's around being between 1 metre and 2 metres for about 15 minutes. And then if you've been over 2 metres, you're not classed as a close contact. So going forward and with variants, when it comes to staff contacts, we are trying to make sure that you stay wider than 2 metres as much as you can from other staff and from parents as much as you can. It's not possible with the children so much, but you can do that with other adults and with the with the parents. So just bearing that in mind, that although we have got rules around it being 15 minutes that you can be in someone's space for, within 2 metres but wider than 1, we want to try and do away with that as much as we can now and just move on to, let's stay 2 metres apart. And again, it's just sort of sharing some of those messages with your parents around the picking up and dropping off, to not have long, lengthy conversations with you as a team, that they need to sort of keep their distance and to help you keep your distance from them. And that's the best way of safeguarding some of your staff. And I think you all know now that anyone who's extremely clinically vulnerable should be at home now shielding, and shouldn't be in work. At the minute, there isn't a risk assessment that we've got at all to ever make it safe for a person who's extremely clinically vulnerable to be in any of these settings at this time. I guess the last one to mention really is around staff who are car sharing. So it's just saying that if ever you're in a car, even if you're wearing face coverings and have the windows open, you are still classed as a close contact. So if the only alternative is to get a bus, then of course car share, but at the minute as well, try not to car share as much as you can. So finally, we're going to talk about how we control some outbreaks that are happening and what some of the things that we've been doing. I'll just share my screen again, and I'll take you to the Warwickshire County Council website. So in here is the Public Health Toolkit. So if you go to on my email at the bottom, I've got the link, but it's basically COVID-19 schools early year settings, COVID-19 toolkit schools early year settings. So here has all the information that if you do have a case, you need to report it via our WCC reporting form. And also just sort of that's to let us know that you've had some cases, and we can sort of see what's happening there and provide some advice. Obviously, there's also the PHE helpline, and many of you use that over weekend. But sort of we're a good point of call. So it's emailing the advisors email address if you want any advice. I'll give you that shortly, or some of the team can put it into the chat box. Another thing is over weekend, if you want any advice, email dphadmin@warwickshire.gov.uk. And again, I'll put that in the chat box shortly. If you can't see the chat box, do sort of say I can't see it, just speak up and say I can't see it, and we'll send an email out to everybody anyway with these links at the end. So this has the guidance on it of who should self-isolate. So there's different headings. So staying at home, self-isolating following a contact in a setting. So that's some information on what you should and shouldn't do. So if you have any parents that have children that have to self-isolate, you can send them to this website, which has some do's and don'ts around self-isolating, and some things like if you are a co-parent, you can sort of, even though your child is self-isolating, they can go to their other parent in that time. And also, should I have visitors, that kind of information. So if you have any parents who've got queries, just send them across this website. ultimately, when you do get your first case, most of you are quite well experienced now in closing the bubble and identifying people to self-isolate. And again, here's the close contact guidance that I've just gone through. Ultimately, we want to keep over the 2 meters now, so do away with the 1 to 2 meters distancing. Ultimately, in your settings, you will have from time to time have concerns and staff will have anxieties about COVID. Now we have our 6 test centres across the county. There's one in Nuneaton, one in Bedworth, one in Rugby, one in Stratford-upon-Avon, one in Leamington in Warwick, and one in North Warwickshire in Water Orton. So we have those sites. They are booked through Eventbrite. So I'll put all the links in here. Yeah, at the minute, there's a question that's just come in saying why test packs not being sent to childminders too. And at the minute, we don't actually have full information on the logic as to why the test kits have been sent to primary schools in the way that they have either. So we don't know why they're doing it that way for primary schools, different for workplaces and different for secondary schools. We don't have that logic. It doesn't make sense to us as a public health department as to why they're doing that. So you've got LFT test kits. Now, LFT test kits, I don't know if you know this already, so I'm just sharing it. They only pick up live virus. So the PCR test kits, they pick up genetic material that are in the virus. So the virus is in your nose and your throat generally. That's where it becomes infectious. That's how you become infectious, because the virus moves to those that skin, that tissue. And then as you speak or as you sneeze or as you breathe, you're pushing that virus out on your vapor. So when you swab those areas, it picks up the virus. Now, when the virus dies and you've recovered from the virus, you still have dead cells of the virus in your nose and in your throat. So when you go for a PCR test, it will pick up that virus is present. And it's obviously a very accurate test to pick up the virus is present, but it doesn't naturally mean that the virus is alive. And actually, we do know that people can test positive for PCR for 90 days after, because the cells can still be in, have the virus in them, but you're not actively infectious. Now, the LFT is a bit different to that. So the LFT has a receptor on the outside, and it's a bit like a flower. It remains out when it's alive, but when it dies, the receptor closes down. And when you put the sort of the fluid which has those cells in, the test will bind to those live cells and create a signal which comes up like the pregnancy test kit. The signal is that blue dye starts to sort of flash, and that's what creates that line in the test. So actually, LFT kits only pick up live virus. So as much as at this time PCRs have been used to now, they take about a day or so to produce the results, but the LFT tests can be done within about 30 minutes and they pick up live virus. Now, there have been lots of concerns around the effectiveness of this test and how accurate they are. As a public health department, our stats show that they're 99.8% correct at picking up that a negative test is a negative test. The only issues we have is that sometimes you get a false positive, and that's why we have that secondary process that if you get a positive, you need to go to a PCR centre and pick up a test there, and then it will confirm that you have had the virus or not. So that's where we've been, that's why we've been using that process. So at the minute, if you have concerns about staff or staff have anxieties, you can go and use the LFT centres in the local authorities as essential key workers, like frontline workers who are having to mix within the job. It'll be really useful for us to have a sheet time switch test. Yeah, that's fine. I can pass that detail on. So ultimately, ultimately LFT centres are across the district, and it's really good for you guys to use those. Now, in an outbreak, this is the important bit. In an outbreak, when you have had more than a couple of cases in a setting where they're in the same bubble, we would recommend that the children and the staff get tested on the day that they're due to come back, or if they're finishing their isolation periods sort of on the Friday or the Thursday, that they get tested over that weekend before they come back on the Monday. The reason being is that in children, actually in adults, because a third of all infections at this time do not have any symptoms. Many of them don't have the top 3 symptoms. They have things like a sore throat, headache. It's really common, a really bad headache, severe fatigue, and also sore throat, severe fatigue, on general cold, just really feeling really unwell in yourself are some of the main symptoms that we're seeing at this time. So what we'll find is that people will go off to self-isolate, and over those 10 days, some people will show symptoms and will go and get tested. And at which point the isolation period extends, because if you develop symptoms, you isolate for 10 days from those symptoms. So as much as they just started a 10-day isolation period, that has to be extended because they've now tested positive. However, some staff and some children will never develop symptoms, and we've been bringing them back into the setting assuming that they haven't been in contact or haven't had the virus. But what's becoming more clear is when you've had 1 or 2 cases in a bubble, that some of those people who never had symptoms do have it, they're just not showing it. And so before people come back to the setting, when there has been transmission between more than 2 people, so say 3 upwards, then we would ask all of the bubble to get tested with LFTs before they come back. Because the LFT works on active virus, we would ask them to complete the 10 days and then get tested. So they don't go and get tested on day 7, they don't get tested on day 9, they do their 10 days and then get a test. So if they're due back, to the nursery and they're isolating on the, until the Wednesday, they're due back on the nursery on the Thursday, we would want them to either get tested, as the very, very earliest, like late that Wednesday night, like the last appointment slot on that Wednesday night. But ideally, the best one is that Thursday morning, and they can pre-book, as that's just gone into the chat. You can pre-book your test. So when you know that you're going to be off, you're going to come back on this date. The tests run from 9 a.m. in the morning to 8 a.m. in the morning to 8 a.m. at night. So if they're due in the setting, just say, go and get your test. By the time you've driven from the test centre back to the nursery, you'd have your result by then, and we know that you're clear of the virus. Another reason why you have to have done your 10 days before you go is because we don't want people who could be positive attending the LFT centres. These are for people who are asymptomatic. Is this an LF test? Yes, so this is the LF test, which is they call it lateral flow test, or lateral flow device. So that when they call it LFDs or the LFTs, it's the lateral flow device, and it picks up the live infectious swabs. Don't get me wrong, as always, there's always the caveat that it's never 100%. It's never 100%, and if you do the lateral flow test and then a day or 2 become unwell, go and get tested again, and don't, and stay off the setting. But ultimately, when people are due to come back on that day 11, get them tested when there's been circulation. Also in families whereby the children have been off because mum and dad have tested positive. We're getting this a lot right now. A lot of parents testing positive and children not, and then them coming back to setting. Going forward, I'm going to create sort of a crib sheet of this discussion, discussing the LFT testing, the PCR testing, and some of these sort of quick instructions. But it will be that if you've had a family or household cases, that those children, if they haven't tested positive in that time, to just get them LFT tested before they come back. So they have self-isolated at home for 10 days. On day 11, when they're due to come back to usual activity, ask them to get tested at the LFT community centres. Ultimately, this is my advice. You are private businesses, and how you run your businesses is up to you. If you don't want to take this advice, it's absolutely fine. I just would recommend that this is what you do to prevent it coming into the setting from children who isolated from close contacts or isolated from household cases. If they test positive at an LFT centre, the instructions now currently at this time are to go off and get a PCR test just to confirm that's definitely positive. Now, if it is an LFT positive, if they have, and this is in a total different context, if I just go back a step, if anyone comes to you and says, my child has been in the setting today and yesterday, we took them off for an LFT test this morning and they've tested positive, we don't wait for the PCR confirmation, we automatically send the bubble off to self-isolate. Even if we're still haven't heard from that PCR test yet, we would still send them to self-isolate. If the test result comes back negative, then fine, they can come back and that's absolutely fine. But if they but obviously we have to act on the LFT test and take it from there. So I'll just jump up quickly and I'll cover some of that again, because obviously I've kind of whistled through it really quickly about the LFT and the PCR test, but there's been quite a lot going in the chat box. I just want to make sure. Sorry, so the bit about me getting your hopes up about test kits, but you can use the LFT centres, and I'll copy and paste that into the box just now. I think Sonia's posted them in. So she's posted in the, yeah, that's brilliant, thank you. So Sonia's put in there the early years advisors at warwickshire.gov.uk. So if you get any cases and you want advice, do contact the early years advisors at warwickshire.gov.uk. Report your cases via the WCC reporting form, so we know that the case is there and that goes on our log. But do, if you've got any advice, do come to us for the advice. You can also use PHE, that's absolutely fine, but do come to us. And why are test packs not being sent to child minus 2? We've covered that. It's hard to understand why PVIs have been left out of this. Yeah, we don't understand a lot of the rationale around DHSC. But there is the guidance, as Mandy's just put in the chat box, to PVI settings. And as a council, we are trying to provide, and that's why this webinar's on tonight, is trying to provide information to you so you know how to use your LFT testing centres. So you click on the link for the testing centre, you book it via that. It's an Eventbrite, and in there it asks, are you an early years setting staff or education, and just click that box. And you can book them in advance when you want it to come back to a work setting, or if you want to have it so that your staff, all of them, get tested on a Sunday before they all come back to work on a Monday, you can book in advance for that. Don't get me wrong, sometimes our capacity is quite low, so that's why it's good to book in advance rather than trying to get one on the day. And that also allows you to plan. So if you do want all your staff to get tested on a Sunday and you find that in your local testing centre there is a low number of slots, you can then stagger them across the Monday maybe and get everybody tested that way. Lateral flow test centre have reported being very quick to get appointments. They are. The lateral flow test centres, it's really simple to book it via Eventbrite. And yeah, and we haven't had any issues yet, but obviously if you do have any issues, do send an email to the early years advisors email address. Our staff have been using the sites, they're great and really quick. Currently there's plenty of capacity at test centres. And it'd be really helpful to have a sheet telling us, which I will provide that. Yes, you can tick the box, and then that's the links. Thank you very much, team, for putting that in. Yeah, so Leamington is probably our busiest site, just to say that. So it says in the chat, the weekend at Leamington LFT site's fully booked very quickly. So the Leamington site has been one of our busiest sites. So if you do need to use that one as your local test centre, there is also one in Stratford-upon-Avon. But if you need to use that as your local test centre, I would plan in advance for that particular test centre. But like I say, if you're inviting families back after they're self-isolated, or any staff back, they can plan for that test in advance. So children can have LFT at the community testing centres. Yes, they can. The only issue that we have had, and this was in like September, October, is when we had outbreaks, the parents didn't want to take their children to get tested. They objected to it altogether, and I think the world in September, when it came to testing, were very anti. I don't want to do it, it's not for me. However, I've noticed this year a lot more parents crying out for testing and want all the children in their room to be tested, and I've had a lot more complaints from parents if the testing hasn't been available. We are now releasing some guidance on early years testing, in the hope to use just the 2 nostrils rather than the throat swab, but that can be a bit slow to progress. Just to add, if you do have any parents who go for the test, if you put your the main concern, I don't know if you can see how well you can see me, the most concern that parents have is when you have the swab and you're placing it up a child's nose, they have that worry that it's just going to go up and they don't know where it's going to go. So what we're recommending to parents, and again, I'll try and put this in the sheet, is to place your finger at the top where the nostril closes, right at the top. Then you can place the swab in the nose and do the twirling, but you're not worried then about it randomly just going up the nose. You know there's an end point to the nose, and that can be a good way to take a sample. So anyone who's doing those kind of swabs, or if you suffer from sneezing, bloody noses, that kind of thing, by placing your finger over where the hole goes up to the back of your eyes, basically, that can give you a bit more assurance around how far the swab's going up your nose. So that's a bit of a tip. So we've been in dialogue with the test centre teams, and they're aware that there will be possibly an increase in demand. That's right, Mandy. So we have been discussing it as a strategy to make sure that they've got the capacity to support. If you do have any issues about using the test centres, again, let us know. And we'll take it from there. So that's everything that's in the chat box. Is there anyone who's got any questions? Do put your hands up or speak. I'm quite happy to take any questions. Will they want to see our reg certificate? No, you go, Eventbrite isn't like an open booking. And you can just go to the test centres as much as you like. It's for anyone, everyone in Warwickshire. So the only thing that you may have is when it comes to your staff when they live outside of Warwickshire, it's been really clear when they book the test, the reason why they're booking it is because they work in Warwickshire, and just stating that as they book the test. So they can put their own address in, but it's ultimately saying I work in Warwickshire, I'm, you know, early years, and putting that in. So, and just to cover again, we're using LFTs to pick up active virus. At the minute, we're not recommending any children go that were screening any sites for it using LFTs. But if you want to send your staff, then you can send them, especially if you've got cases in your, if you have had cases in your setting, then it might be an idea to kind of send all the staff like maybe a couple of times in a week to go and get tested, do it as stagger. So you've constantly got that insurance that you haven't got anything happening on your site. But most settings either kind of go from no cases to a few cases, then back to no cases again. It's not like something that keeps bubbling on in nurseries, thankfully, so far or yet. The main thing about using LFTs is that if you've got a group who are more than 2, so about 3 people that have got infection, to make sure that you screen them on day 11 as they're due to come back, so you make that it's clear. So I've recently tried to get PPE for childminders in Coleshill. We've given one first wave of COVID. Is there anyone I can contact to try and get some more at all? At this time, we haven't got provision of PPE for PVI. I can have a look to see whether there's any providers that you can purchase it from, but unfortunately at this time. But if you want to email the inbox to ask what you want the PPE for, I presume it's face masks. And it'd be really interesting on what you need the face masks for. We can have that discussion about that. At the minute, as you know, there's face masks, which are they're surgical masks, which are fluid repellent, and those are called FFP2s if they're the hard cone, or the IIR if it's a soft surgical mask. And that's what we use when we're trying to sort of either work with a child who is unwell, who has COVID, or that we suspect that they have COVID. So that's when we use that level of PPE at the minute in nurseries. So that may be the PPE that you're looking to get or that you're looking to use, but at the minute we're not using those widely. The only other PPE is face coverings that, although it has evidence to prevent some spread, so some nurseries are asking that parents wear a face covering when they drop their kids off or when they pick them up. It has evidence that it prevents some spread, but at the minute we don't know by how much scientifically, mostly because all the different face coverings are made of different materials. It's hard to get a clear point on how effective face coverings are, except the fact we know that there is some effect. But in the type of nursery settings, wearing them all day long isn't going to have an impact on transmission. So I wear face masks daily as I do school runs too. I would prefer to wear a visor indoors to protect me from the children. So if there is a set, so in this case, Kelly, it sounds like you want to work with children and wear a face mask, which is the IIR fluid repellent type, so that you're giving yourself the maximum medical cover when you're working in the setting. Just to bear in mind that what we are finding is that even those that are wearing the medical level face masks, because they don't follow the guidance on how to don and doff, which is put on and take off that protection, that it's not actually providing much more protection than if they actually just followed other measures more, like hand sanitizing, keeping a distance where they can. Obviously in nursery settings that's a lot harder. It can provide some, so if you are really concerned, well, obviously that's our medical level, that's what we're protecting all of our healthcare staff with. If you definitely want to wear them and you're paying for them yourself to get them, then make sure you look at the guidance around how to do that as safely as possible. Visors don't confer any protection. They can block your vapor coming out your mouth if you're wearing it low over your chin, and whereas I've noticed a lot of staff wear it up on their forehead. And yeah, thank you, Sonia, that's the link to the PPE description that we've got on the website on the different types of PPE and when to use them. If you're dealing with children who spit quite a bit, then yes, 100% wear a visor. It's designed to protect your eyes and obviously your nose and mouth from any of that spitting. But if you're in a room with them all day, working very, very closely for long periods of time, unfortunately, the PPE will provide some support for you, but it won't 100% protect you unless you're wearing it as you know, as medically as you can. And medically, when they wear it sessionally for hours at a time. So if you follow that guidance, then do. If that's what works for you and helps you out, but just make sure you read the guidance on exactly how to medically wear it. And if you are wanting to use PPE in these settings, although that's not recommended, audit each other as well on how you're wearing it, because we have had outbreaks with social care and in care homes that they've been wearing it, but because they haven't been wearing it properly, it hasn't given them the protection, and then they've kind of been in each other's space a lot more thinking that the PPE will protect them, and it hasn't. So staff will be considered close contact even if we're wearing PPE. Yes, so we are finding, because you're not trained to wear it, then PHE do still class you as a close contact and you do still have to self-isolate at this time. The only times in which we have classed people wearing PPE not as close contacts is when we have seen evidence and audited their evidence on that they've had the training, that and this has been in special schools whereby staff are wearing PPE a lot of the day when they are in specific roles, when they have to go across bubbles, and that's to keep their staff ratios. And ultimately, we have audited them, we have reviewed their training, and other staff have audited them and said that they have been compliant. But we do have in care homes even breaches in PPE where it has spread. So just be really careful about using PPE, because it can make people think that they're protected from it when they're not. So I think that answers everything. Is there any questions more? There's been quite a lot of chat. If there's anything that I've missed that I haven't answered, please do put it in the chat or email me. So on the meeting invite, you should have my email address or the Early Years Advisor's email address. Please do contact us and do let us know if there's anything we've missed, because that was really, really quick, although it was still like sort of 50 minutes. But do let me know. Okay, thank you. So that's great. And Sonia, or any team, anything you want to come in with and add that I haven't covered or I've said wrong?
No, I'd just like to say thank you, Leanne. I've got lots to go into the risk assessment that we did. So we're just in the process of updating that. So it's just been really useful to hear and to have some reassurance tonight as well. So thank you from all of us.